If you're a guy and you don't, finish for a while, does your body just absorb it? Pretty much. If semen doesn't release, it's not like you continue to have this like build up.
Is it true that if you don't use it, you lose it?
Is that a serious question?
No, it wasn't.
Okay.
If you don't release, your body actually is a great recycler, so it actually will break down old sperm, basically recycle those components and rebuild new ones. The body does have other ways. We've all heard of the wet dream, but again, it doesn't have to. You're not going to explode. Your body will recycle even if you're not using it. We get this question a lot because of No Nut November, but it is not a health risk. Some people believe that holding off might build up testosterone and give you that advantage. It might slightly for the first few days, then it actually goes back to normal. The body is very good at regulating its hormones. Other things that will help your testosterone levels would be like sleep, your weight, your diet, your hydration, heavy lifting. Those lifestyle things will actually have more benefit. What is Alice in Wonderland disease? Very interesting. It is a neurologic condition. The people with this experience distortions of time, space, shapes, objects. So your hands might suddenly look tiny.
Good to see you again. Are those fake hands? No. What are those? Fake hands?
Or a room might all of a sudden look like a fun room in a weird shape, like it's stretching out. These episodes could actually last seconds to minutes. They could also be related to viral infections. Doctors think Alice in Wonderland syndrome is linked to like the visual processing center of the brain or the temporal lobe, where it only lasts a little bit of time and it's temporary, possibly related to migraines. It is so disorienting, confusing, and could be stressful.
Doesn't anyone notice this? I feel like I'm taking crazy pills!
And if you're experiencing this, you definitely need to reach out to your doctor because this is not a normal activity that you should be feeling. Do boobs really sag faster if you don't wear a bra? So no, not necessarily. The idea is that the bra is supposed to be supportive, holding up the breasts, and will prevent the skin from sagging. The more likely aspect of skin sagging has to do with the elasticity of your tissue. So they actually show that potentially if you're wearing bras all the time, that you're reducing the muscular tension that you're having of your chest wall. So your breasts are made mostly of fat tissues and glands, but underneath the muscles that you have there, if you're not using them as much, could actually cause things to be not as tight.
I've lost 180 pounds.
Congratulations, baby.
Thank you. I do have a little bit of excess skin, though. Bit of a problem here.
Factors that would decrease your elasticity: sun exposure, dehydration, genetics, age, weight gain, and collagen. But strength training in and of itself could actually help the muscles underneath and tightening those up. Can you survive without half a brain and still be you? Yes, you could, and you can live a totally normal life.
What would you do with a brain if you had one?
There are a couple factors. In 2024, there's a 16-year-old that made the news because she had half her brain removed because she had a prenatal stroke, which then led to continuous seizures. And the only way doctors could treat her was to remove half the brain, which is called a hemispherectomy. That part of the brain that they had to remove had some speech components to it, but because it was at such a young age, her brain was able to develop and function to where she talks, she walks, she smiles, she jokes, all normal activities, and lives a normal, fulfilling life. But if this were to happen in adulthood, it's a different story because those neural pathways have already been formed. So the brain as a younger child has a lot of neuroplasticity versus as we're a little bit older, we already have all these pathways already developed. So when you then remove them, you potentially will lose a lot of yourself. So in Maura's case, her right hemisphere took over for all of the processes: speech, motor, and sensory function. If this were to occur in an adult, you might see hemiplegia and hemiparesthesia. If I shower right after sex, can you wash off an STI? No. Once those bodily fluids mix, they're there. Most of the time it's related to exposure to mucous membranes, and when you're washing, you're doing more of washing of the surface or the superficial areas. So no, herpes, gonorrhea, syphilis, you can't just wash them off. You can't just urinate to clean everything out. It doesn't work that way.
I have exorcised the demons. This house is clear.
Make sure if you are worried about exposure that you do preventative measures, barriers, abstinence, those sorts of things. Is it possible for a person to have two sets of DNA? Yes, very cool, and there are a couple scenarios where this could happen. This is actually called chimerism. The first way is when two fertilized eggs, so almost like parental twins, fuse together and become one person, but they have two different sets of DNA. That could happen in utero and then delivered as a single human being. And then the other would be like a bone marrow transplant. So red blood cells, white blood cells, platelets are made in your bone marrow, right? Say you need new bone marrow. By medications and different therapies, we're able to basically knock yours out and then give you new bone marrow of somebody else. But yet you have organs, you have all these other things that are basically made up of your DNA. So you have a mixture of both. Is running actually good for you or bad for you? Be honest. After years of running, my joints would say it's more bad for me. Well, it depends on how you do it, how much you're running. If you are running marathon after marathon after marathon for year after year after year, of course, it's like a car, right? You're wearing it down and sometimes joints can't take it. They may need to be replaced, so you have to just be careful. Running is a aerobic activity, good for cardiovascular health. It also helps with bone building and strengthening because of the pounding and the destruction of the bone, but rebuilding. But your joints, the cushions of our bodies, will eventually wear over time. So you do have to be aware of that. So running in moderation is key, especially adding cross training with that, strength training, rest, recovery, because if you're just doing one activity over and over again, just like anything in life, too much of a good thing could turn into something bad. Why do some people remember their dreams vividly and others almost never? I dream a lot. My boyfriend says he never does. So everybody actually dreams, and you're dreaming during the sleep phase of REM, rapid eye movement. Your remembering of the dream typically has to do with how much time is spent and when you're actually waking up from your sleep. If you wake up mid-dream, you're gonna remember it. Brain differences in memory and emotional processes also play a really key role in if you're going to remember your dreams. So biology does play a big part of this as well. If you are having difficulty with sleeping or you want something extra to support your sleep, my company, Life Happens, has a product called Do Not Disturb. It is melatonin free, magnesium, L-theanine, passion flower that will help to give you a restful night of sleep without the grogginess. Wake up refreshed to attack the day. If you're interested, check out Do Not Disturb at lifehappens.com or on Amazon. I have heard a weird phrase. You're not actually dead unless you're warm and dead. What does that actually mean? That is something we do say in medicine, especially in what I do for a living in emergency medicine. You're talking about hypothermia. Causes the body to slow down, slow heartbeat down, cellular processes. Say somebody comes in and their temperature is 34 degrees. We don't call a code and we don't stop until that person is warmed up, and we're continuing to do resuscitations. Sometimes electrical energy, cardioversions don't work as well. Medications won't be processed as well when somebody is hypothermic, so we need to warm them up.
I'm so cold. Come on, big cat. I think I see blue.
We would use warm IV fluids, blankets. We have something at our hospital called a bear hugger. And so we do everything possible to get somebody warm quickly, especially if they're in cardiac arrest, while continuing to do our normal ACLS protocols, such as chest compressions with medications such as adrenaline, aka epinephrine. Do identical twins have identical DNA and fingerprints? Like if one twin committed a crime, would the other be potentially charged or found guilty? Twins in general have near identical DNA, but what happens over time, the body repairs, checks and balances, and makes new DNA.
I'm your twin brother.
Oh, obviously.
But when it comes to fingerprints, the fingerprints are individual, meaning that they're typically made in utero. It's related to pressure, amniotic fluid, fetal position, just depends. So if one of the twins commits a crime, but the other one is caught, there could be some confusion by the investigators by DNA alone, but once you get the fingerprints, then it shows separate individuals. Are any of you twins out there? Let me know in the comments. Is it true that a tampon can actually get lost inside of a woman? This happens more frequently than you think, and for multiple different reasons. People think they forgot the tampon, it might be in there. Some people didn't realize they left it in. Sometimes they've doubled up. But usually what happens is they get stuck on the side of the cervix, up and back. If it's compacted and way up on the inside, we as emergency medicine physicians or OBGYNs or even some family medicine doctors out there that do pelvic exams will have to go in and remove it. Typically, we're using a speculum and ring forceps, but our concern is that if it's left in too long, it can cause toxic shock syndrome. We typically cover individuals with antibiotics if there's discomfort or discharge. People will also use other material that is not a tampon in the place of a tampon. Most of these don't have strings to retrieve it, so please don't do that because I've pulled out many makeup sponges that I do not want to pull out in the future.
No. 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 Hell no.
I heard some countries prescribe spending time in nature for healing processes. Do you think that really helps from a doctor's point of view? Yes, it's called forest therapy or ecotherapy, and it does have studies to show that it helps by calming the body, calming the mind, and reducing stress, aka reducing cortisol levels. So as you reduce cortisol levels, you're reducing your flight or fight response, you're reducing these other hormones from overtaking your body. So if you're feeling stressed, definitely get outside in nature, feel the sun, smell the air. It could slow your heart down if you're somebody who suffers from tachycardia or tachyarrhythmias, improve your mood, increase your immune system. In Japan, they literally have something called forest bathing where doctors actually prescribe you going out into the woods or the forest. So it is proven therapy for mental and cardiovascular health. It might be a lot cheaper to try this first than going to the doctors or throwing a lot of medications at something. Not always is it a replacement, but it's something that you can try. If you're not feeling well, definitely go see a doctor. These questions are so good. Literally the stuff I deal with at the hospital all the time. So please keep them coming. Send your questions our way. If they're interesting or we think somebody else would benefit from your question, we'll definitely talk about it. And if you guys enjoyed this episode, definitely check out this playlist right here, Binge Watch Everything. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.